Hi, Dr. Magaziner here again for my medical moment. And what I want to talk to you today about is my Wellness 360 or Diagnostic Dozen. This is something I put together over the last many years of being in practice. And what I found is that there's 12 common denominators, basically, that I use to assess my patients. Regardless of what your complaints might be, it says here in the middle, patient complaints and symptoms. I really believe that we have to look at the causes, the root cause of the problem, and try to find out what is triggering the patient's complaints. Whether they have high blood pressure, whether they have headaches, whether they have hormonal dysregulation, autoimmune diseases, all these have common denominators. And so let me read to you what some of these 12 things says here, because I think these are the things that are so important that we assess, because each person is an individual, they are different, and the triggers for one person versus another can be completely different. So for example, if one person has, it says, nutrient imbalances, it might trigger high blood pressure, but another person, maybe it's triggering their migraine headaches or their diabetes or something like that. So this is one area that we frequently will look at are the different vitamins and minerals that are so important in each person. Another aspect, it says here, digestive and absorption capabilities. And we all know that the microbiome and the intestinal tract is so important for the entire body, and it's more and more we're finding out that this can cause inflammation if we don't have proper balance. Next thing we have here, I'll move ahead a little quicker, but it's food allergies or food sensitivities. I also want to mention pollens and dust and molds and environmental factors can also play a role in the way that we're feeling. Mitochondrial dysfunction, reactive oxygen species, and also oxidative stress kind of go together. It's a crucial part of all physiology and all health conditions today. We're finding more and more aspects of chronic diseases are in part due to mitochondrial dysfunction. We also can take a look at different hormonal and neurotransmitter dysregulation, as well as stress response, electromagnetic fields. We're all exposed nowadays to EMFs through our computers and through our cell phones and other aspects, and that can play an important role in how we're feeling as well. Detoxification, very, very important, of course. We know that today. We're exposed to over 85,000 chemicals that are in development today. We're not exposed to every one of those, but we're exposed to many of these. And these too can impact on the way that we're feeling. The sluggishness, the fatigue, the fibromyalgia, autoimmune diseases can all in part be due to problems with detoxification. We take a look at environmental chemicals, heavy metals, pesticides, and other things like glyphosate. Those too can play an important role. We find that many patients in our office have high levels of lead, mercury, cadmium, arsenic, nickel, you name it, we find it. But what I'm getting at is that can induce high blood pressure, can induce diabetes, can induce cardiac irregularities or what we call arrhythmias. So we have to take a close look at these things as well. Genetic susceptibility. Many people are susceptible to different genetic problems because of mutations in their genes. And also we have up here is immune dysregulation and inflammation and infection. Inflammation, we know today, can put us at risk for things like cancer, heart disease, high blood pressure, autoimmune diseases, obesity, diabetes, and much, much more. So what I've done now is we take a look at these factors because every person is different. Every person's unique, they're an individual, and these are things we look at regardless of what patient's complaints might be, because we're getting to the root cause, not just treating the symptoms. So if you want to find out more about this, contact my office, and we can sit down and discuss these different factors that may be impacting on your health care. Thanks for listening. We'll talk to you soon.